I'm still here for my younger self and for every kid out there like me.
I'm still here fighting for trans awareness and human rights.
I'm still here to help build a bigger and stronger community for my trans brothers and sisters who come after me.
I'm still here for trans youth and for LGBT youth.
I'm still here to remind people like me that their future is just as bright as they want it to be.
I am still here for my patients in the rural parts of this country, struggling to find queer and affirming providers for my younger self and for my child's future.
I'm still here for everyone who came before. They never gave up, and neither will I.
I am still here for my younger self.
For my younger self.
For my younger self and the future generations of queer and trans youth.
For queer and trans youth.
For queer and trans youth.
I'm still here to celebrate the real me.
I am still here for all my Southern queers, for all of my current and future patients.
I am still here for the trans kids that never got to grow up.
I'm still here for my daughter. I'm still here for future generations.
For future generation.
For future generations.
I'm still here for trans youth in Florida. I'm still here for my queer siblings.
I'm still here so that I can be the mentor for others that I really needed.
I'm still here to dismantle injustice. I'm still here because there's work to be done.
I'm still here to inspire and validate those who have fought so hard to bring acceptance into our lives.
I'm here for the trans and queer youth who are looking for help along the way.
I'm still here to help destigmatize, to educate.
We're not going anywhere. We're here and staying here.
Folks, we're still here too. We were born out of necessity and we stay committed to providing affirming, accessible, and life-saving healthcare for our LGBTQIA plus community. Let's show the world that no one can erase our existence, our resilience, or our pride. We're not going anywhere.
A few days ago, one of the organizations I volunteer with held a conference call about the state of trans healthcare in the U.S., featuring rock star journalist Erin Reed of ErinInTheMorning.com, Folks Health VP Haley Everhart, and clinician Kate Steinley, a member of the American Telehealth Association. I've edited the call down for time and relevance, removing things like lengthy introductions and interjections, such as informing latecomers of where to post their questions. This call does cover a lot, so feel free to watch back if you need to take a note on a particular item. With that said, let's see if we can find some good news.
Erin, I will kick it over to you to start. You've been tracking all of this in real time. Can you give us, whatever that looks like in today, a bit of a lay of the land? What's been happening, and what's some of what we're seeing come down from the administration?
We are seeing attacks on transgender healthcare, with the executive order that banned gender affirming care under the age of 19. We are seeing passport restrictions in several places. We are seeing attacks on teachers, where there's an executive order that says that if you affirm transgender students in your school, they could be targeted. And we are seeing attacks on transgender people in the military. Now, what we're also seeing is changes in rhetoric. So, many of you remember the military ban, for instance, of 2017, and in that ban, the stated reason was because gender affirming healthcare is too risky to give to troops, and we don't want to do it. However, we in the current ban that we just saw, the stated reason is actually because transgender people are inherently dishonorable, disloyal, and untruthful. And so this escalation in rhetoric has been a big deal. We've also seen, and this is something that I think is going to touch all of you in a very particular way, the sort of mass removal of the word transgender from all government websites, but not just government websites, nonprofits that get federal grants, NGOs, even organizations outside of the United States that depend on federal money and federal support. And one problematic thing that I'm seeing, and many of you, if you read my work, you'd be aware of this, is overcompliance. I have spoken, I attended the ACLU's press briefer on these executive orders. They are not self-enforcing. They are glorified legal memos. There's no statutory authority, for instance, for the things to be done that it says the executive orders will do. And so, unfortunately, even with that, we are seeing organizations strip the word transgender from their own documents. So, for instance, the National Center for Missing and Exploited Children did this. We saw all resources for transgender people in that center removed. And in fact, in that center, they were told that they have to dead name and misgender their transgender missing posters for missing children. And like, that doesn't even help. Like if you are, the stated goal of this is like protecting the children, but you're not going to find transgender youth by not using their name, by going by pronouns that they don't go by anymore, by, posting pictures of them as they were a long time ago. So that's a big, broad view. Each one of these sectors has a lot of litigation going on right now. There are court hearings. For instance, the under 19 ban was just overturned, just blocked with a temporary restraining order in Washington, Oregon, and Minnesota, as well as in the PFLAG case in Maryland. And so we are seeing some victories. The anti-DEI executive order that has resulted in like the global gag rule on transgender people, that is also blocked. It was challenged by the NAACP as well as the, I think, Transgender Law Center. So there's a lot going on, open to talk about any of this. And yeah.
I wanted to ask you, since you've been talking to so many people, as you mentioned, these executive orders are not law, and yet we're seeing dramatic impacts to care, to how people are talking about trans people, to the resources that are available to trans people. Can you explain what you see happening? Why?
I think that when these executive orders came out, it was sort of a shock and awe campaign. And it had that effect on a lot of organizations, even organizations that have no exposure whatsoever to any federal dollars. I have seen them, uncertain as to whether or not they could comply or whether they should and like what they should do. And that was the intended goal of this. I've been critical for those of you who read my work. I've been critical of organizations that do this because it doesn't just affect that organization. It affects everybody. It's one thing for the government to remove the word transgender from all their resources. It's another for children's hospitals to do the same. It's another for general hospitals to do the same. Then whenever we start to get to like nonprofits and even LGBTQ resource centers that receive federal grants, removing the word transgender and gender identity, where are you going to see that word? Right. Like it becomes a word that you have to whisper hushed around in public. And I've spoken to people who have made those decisions, to people who are on the boards of some of these organizations. I've spoken to some of the CEOs at these organizations. And one thing that I say to them is that eventually you're going to have to draw a line. Like they're going to continue to erode on this issue. For instance, the next step is going to be PrEP. We see attacks on HIV prevention. And some of these organizations were established around HIV prevention. And so my question to them is, what do you do whenever it's not transgender youth, whenever it's transgender adults? Or what do you do whenever they say you've got to remove all PrEP from your website? What do you do whenever it's birth control? Like, do we expect hospitals that receive federal dollars to remove all references to birth control, for instance? Like, these are the things that can come under attack the exact same way. And given that these executive orders are not self-enforcing, that they are not backed by statutory authority, the best way to handle them is to confront them up in front, not to just allow them to sort of chip away. There's a book, I don't know if I do, On Tyranny by Timothy Snyder. The very first page of this book, do not obey in advance. And it specifically says that people who try to guess what power wants, and they go that extra mile, the people that overcomply, are the people that teach power what it can do. You're teaching them that if they do something, it doesn't even have to be backed by a law. If they do something, if they say something, then people will follow. And that paves the way for much worse. And I think that's the point that I made, and they understood that.
This obviously sounds and is horrible. Kate, can you talk about what this is like for trans people? We at Folks have tens of thousands of trans patients, and you personally have cared for thousands of trans people. Like, tell us what we're seeing right now.
What is happening in the political, regulatory, and just cultural landscape, where it is a constant, as Erin said, chaos and confusion and overwhelming number of stuff that is going out there that is directly attacking people's bodies, lives, the way they interact, and the feelings of being unsafe, the feeling of just being isolated, the feelings of hopelessness. We're seeing, in terms of the patients that we see, higher acuity, more suicidality, hopelessness, isolation. We saw that increase in anxiety even during the election year when there were campaign ads that were directed towards people's identities and targeting trans people specifically. And now we're seeing this proliferation of executive orders and bills that are actually affecting it, right? So before it was just the crappy stuff that's on campaign ads, and now it's real.
I should remind everyone here that Kate is a clinician, so isn't as aware of the preceding waves of anti-trans bigotry driving unprecedented volumes of legal action we saw in the years leading up to the election. From her point of view, we passed a critical milestone, and all this stuff we've been watching build up for years suddenly sprang onto her radar all at once. I say this partly to explain why she seems to be operating as if all this codified hate was something new in 2024, and partly to point out that for a lot of Americans, the ones who weren't impacted by discriminatory laws and so never noticed them before, Kate's perspective is the American public's perspective.
Some people were getting care at some of these locations that have taken those preemptive following of executive orders and then can't, or again, are worried that they might not be able to, that threats of government funding being withdrawn. So I think that ability, for a community that already has not had, that has, let's call it this way, substandard, much more than substandard access to care, to quality and excellent care. They are now worried about even losing whatever access they did have. The impact to mental health is real for this community.
Erin, can you talk about some of the state responses?
I will say that there is some good news in that we have seen a sort of run of positive lawsuits for transgender people. This comes after a pretty negative period for around 3 months in the lead up to the election. What we are seeing right now is in Oregon, Washington, and Minnesota, there's a temporary restraining order on that under 19 care ban. I believe Colorado just joined that case, and a couple other states may have joined that case as well. In Maryland, the PFLAG case also challenged that same exact rule. In both cases, judges have ruled that, at least for now, they cannot take away federal funding for giving transgender healthcare to people under the age of 19. State attorneys general in, I think, like 17 states or so, signed on to a letter saying that it is their opinion that the executive orders are not legal, that they're not enforceable, and therefore all healthcare institutions in those states should continue to provide healthcare. We just had a case, temporary restraining order in the NAACP case, which is the DEI case, which also applies to the gag rule where they're removing the word transgender. There is a restraining order on organizations not being able to have their federal funding stripped if they promote DEI. That's that particular ruling, and gender ideology is the other word that gets used. Another case that just happened was on the there's another one. There's one that's currently going right now that's on the military ban. That one has not been decided yet, but I'm expecting Judge Reyes to be very supportive. The questions that she's giving make it seem like she's very well read on the topic, and it seems like she's going to rule in our favor. And we just got a major case in Montana, which is, where I spend half the year at with my wife, stating that the definition of sex law, which defines sex as binary and unchangeable and applies that to all code in Montana, so like driver's licenses and more, that law was deemed facially unconstitutional in Montana. So we've been on a pretty good run of a lot of very positive court decisions. Oh yeah, the CDC data, the healthcare data, which is obviously going to be something important to all of you. Whenever they had the sort of stripping of all information from government websites, one of the things that they stripped was one of the youth surveys, because the youth survey included a gender identity question, and that entire survey was removed. The Trump administration was ordered to put that information back up. And so they did, but they put like this big sort of like disclaimer where they're like, we disagree with this ruling, we hate everything, and here gender ideology sucks, things like that. And so we have had all positive rulings. In fact, I don't think we've seen a single negative ruling yet. The last thing I'll say is that we are working our way towards a SCOTUS ruling. That's going to probably come in summer, and that ruling is going to be on scrimetti, which is the case that determines whether or not transgender people get equal protection under the law. That will have huge impacts on everything. I couldn't tell you how many impacts that's going to have. And while I will say that, I think a number of people, especially whenever the case was going on, are skeptical that the Supreme Court is going to rule in transgender people's favor, there are two things that I will note. A very similar court, down one liberal, up one conservative, ruled 6-3 on the Bostock decision, guaranteeing equal protection under employment law. And the second thing that I'll note is that there are a couple wild cards in the Supreme Court right now that I'm watching. I think that Justice Amy Coney Barrett is actually a surprising wild card. If you ever review her decisions, she declined to overturn a drag ban. She has declined to take sports ban cases out of West Virginia. And her questioning made me think that she could perhaps rule in our favor. Her big thing was that she actually was not aware of the history of discrimination on transgender people. She actually asked a question about it. She's like, I didn't know that that was like a thing, that transgender people have a history of discrimination. Are you sure? Like, can you give me more examples? And Chase Strangio did a great job, gave more examples. The reason why I say that that's really important is because we are seeing the animus from the current administration actually infect other court cases. Like, we're seeing judges point to say, like, we just saw Justice Reyes in the military ban case, point to a whole other area, point to the Stonewall stuff that's going on. She said, like, hey, how can you say that there's no discrimination against transgender people whenever your government is erasing them from the very history that they helped create? Like, if you go to the Stonewall page right now, for those of you who aren't aware, they stripped transgender from Stonewall National Monument. If you go to Stonewall National Monument in Google and you click on the National Park Service website, you'll see that Stonewall people fought for LGB rights. And then for Sylvia Rivera, the transgender woman who was the most involved, one of the most involved in the Stonewall Uprising, they changed that she fought for gay and trans rights to she fought for gay and rights. Like, they've just literally removed the word transgender. It doesn't even make sense anymore. And so I think that, if the justices are watching what's going on in the United States right now, the sort of ham-fisted approach that the Trump administration is taking right now may actually factor into the Supreme Court's decision as to whether they're going to grant equal protection.
Thank you for laying all of that out. Kate, as here at Folks, we serve trans people in all 50 states. So can you talk a little bit about how we're approaching healthcare and how we're looking at the landscape right now?
Nothing has changed for us in the way that we have been providing care and the access that we have for our members across the whole country. And I think that's a really key piece because, again, this misinformation and the chaos of people, we get questions all the time from people who are worried. Did this happen in my state? Do I still have access? And so the fact that what we're doing is trying to just disseminate as much clear information about what we are doing, what we're watching, how we will pivot if we need to. We're going to do everything in our goddamn power to make sure that we stay open and active for every single state that we possibly can.
What kinds of resistance are we seeing? What's working? Like, what are some wins for us to hold on to?
Yeah, absolutely. So, there's a lot of, it's not just all bad news right now. I'm seeing a lot of lately is actual sort of a rise in the willingness of people to go and protest and to demand that certain things change. And I've seen this actually have a positive impact. Let me give you a couple examples. My local children's hospital canceled care for transgender youth. They were one of the 20 or so across the country that did this. Most hospitals did not respond to the executive order by canceling care, but some did. And in our area, we have strong protections for transgender healthcare. I live in the Maryland and DC area. And so within a day, I helped organize a protest to go down to the hospital and say, we were very respectful, but we raised trans flags and said that trans youth were worth protecting. A very similar thing happened that very same day at UVA healthcare, where they did the same thing. And then within about 5 days of those protests happening, both of those healthcare institutions returned to offering care, despite all of the anti-trans and anti-queer actions that we've seen over the last year, and especially over the last 2 months. The Gallup poll just came out where they did a study on LGBTQ identification. And America is queerer now than ever before. We have more LGBTQ people that are out and proud than ever before. In spite of everything, in 2023, it was 7.2% of people identified as LGBTQ. As of this year, it's 9.3%. That's a huge jump in a single year. And what that shows is that all of these actions being taken against LGBTQ people, and especially trans people, they're not being taken because people hate us. They're not being taken because people want us to go away. They're being taken because people accept us for the first time in a long time. In many of our cases, they accept us. And so the organizations that are behind these actions see this as their only option. They see legislation, they see executive orders as their only way to try to stuff the genie back into the bottle, to make us all go away or make us all go back into the closet. But we're such a huge part of the United States. We're such a huge part of the world. Like, we're not going anywhere. And I think that the willingness of people to come out is in and of itself a humongous victory. That's something that we should all be proud of.
In visits that we're having with patients, we are talking a lot about what does it look like to the importance of just finding spaces to connect with other people that can offer you comfort and safety and feeling loved, because there's going to be a whole lot of noise externally. So find those spaces. Also to take the opportunity to move away from people that to stop contact with people who don't support, right? And I actually had a visit with a member yesterday who was like, I actually stopped contacting my family who is a Trump supporter, and because it was too much for me. And I think this is the time to take that self-care that supports mental health. And this is a long process. We are going to be in this for a long time. And the longevity of staying in that fight requires people to take care of themselves. And I think, again, reaching out to your trans family, to your friends. So as an ally, as people who are not trans or non-binary right now, call everyone that you know who is every day and tell them that you love them. Tell them they are beautiful. Like, do that, because guess what? Like, it doesn't matter. You can't tell somebody enough at this moment how incredible they are, because just counteract the shit that's out there.
Really appreciate you sharing that, Kate. And, Erin, I'm curious how you are caring for yourself right now, and how you would suggest that other folks in this, I mean, you're spending your days and I'm sure your nights also thinking about this, thinking about the attacks. Like, how are you taking care of yourself, and what advice do you have for other trans people and allies to, stay grounded, stay connected?
Yeah, I mean, you're right. I have been spending a lot of days and nights and early mornings on this particular issue. What I will say is that, cherish the people who cherish you. I've got my 9-year-old son upstairs. I'm going to immediately after this watch Hilda with him, and maybe watch Smile House or something with him. I've got my wife, Representative Zephyr, who, unfortunately, because she's in the legislature right now, we cannot be with each other right now. But as soon as we get off right here, she's going to be on a little video call the whole time. Like, I put her right in bed beside me on my laptop, and that's how we get by. Find something that brings you joy that has an end point. So much of this work can feel like it is relentless. Like even if you win, you're going to have more fights, and it pushes and pulls and pushes and pulls, and it can feel like you never reach an end point in this work. And so if you have something that you enjoy that has an end point, that's just psychologically good. That's like life advice for you. So an example for her is she loves painting D&D miniatures. And she paints it and it looks beautiful. She's developed all these techniques, and then at the end she can hold it and it's finished. And what she says, I love the way that she says this, and she's like, after I'm done, the governor cannot veto this. Like, it is here, it's mine. The governor can't veto it. For me, it might be hiking, it might be photography. Like, do things that have a finished product. Find those things that bring you joy that have that. I think that is something that we all need as human beings. And also for the allies in the room, make sure that you find your lines and hold to them. We all have our lines as far as what we're going to accept and what we're going to like draw a line in the sand and say, I'm not going to do this. And many people might be told to do something that they're not comfortable with. And we're seeing it right now. We're seeing it throughout the government. We're seeing it from government workers. We're seeing it in nonprofits. We're seeing it in organizations. And the people that are going to be the ones who protect us are the ones who are who do hold positions of power, who are in a room where they can do good in. And whenever you are in that room, and you see the opportunity to do good, do it. There's a story of, I've been tracking this for so long, y'all. In Texas, they had in 2022 or late 2021, I'm forgetting which year, they had the child abuse stuff where Governor Abbott told all of the child protection services agents to go sweep the state for trans kids and to try to basically accuse their parents of child abuse for allowing them to exist. And there was one person who was an agent, and he went to all of those homes and closed the cases. And his stuff was not being watched. He was an agent. He has full control over which cases are going to be open, which are going to be closed. He put his job on the line. He put a lot on the line, and he saved a lot of trans kids. You might, be that person. It was a hard decision for him to make, but he made it. Be that person. Show up to community organization meetings. Whenever you're in those rooms, try to do some good.
Thanks to Folks Healthcare for hosting that conference, Kate Steinle for sharing her expertise, and of course, Erin Reed for her relentless excellence and steadfast dedication to our community. If you enjoy content like this, make sure to subscribe. Transpositions Weekly is the first and only weekly trans news show in the universe, and we need your support to keep this show going. Contribute at patreon.com/thetranspositions. Spread the word all over social media to let people know we're here, and tell us what stories matter to you by joining the community on Discord. Discord, of course, is where the memes live, and our meme of the week was posted by yours truly. And if you want to strike fear into the hearts of the rich and powerful simply by persistently existing, join us. Also, if you have good news concerning trans people you'd like to see reported on, you can tell us about that in the Discord as well. For the Transpositions, I've been Ember Belrad.
As an ally, as people who are not trans or non-binary right now, call everyone that you know who is every day and tell them that you love them. Mm-hmm. Tell them they are beautiful. Do that, because guess what? It doesn't matter. You can't tell somebody enough at this moment how incredible they are.